The DSM-5 lists repetitive patterns of behavior, interest, or activities as a qualification of diagnosis for autism spectrum disorder. Inappropriate repetitive verbal behaviors, IRVB, is a stereotypic activity that focuses intensely on specific words, phrases, or types of interaction. Verbal operant training is an effective method to generalize IRVB and to shape it to an appropriate behavior, an effort to maximize training, an effort to examine and train appropriate language. Cullen, Ahir, Clark, and Mulaski wrote an article in 2012 and stated that the verbal operant training and response, interruption, and redirection can increase appropriate vocalizations in individuals and reduce stereotypes and reduce vocal stereotypes. A study completed by Habarad in 2015 resulted in a correlation between a demanding repertoire and inappropriate behaviors. For the sake of protecting my client, we'll call him Herbert. Herbert is a 10-year-old boy diagnosed with autism. He was diagnosed by a children's specialist at the age of 2 years and 2 months. Herbert now receives one-on-one ABA therapy with his therapist, Amy, from 4:30 p.m. until 6 p.m. each night. Herbert engages in reinforcing activities during his free time. The highest reinforcing activities include watching Pixar movies, playing video games, watching or listening to music videos on YouTube, looking at pictures of his favorite characters from the favorite movies. When Herbert is engaging in these activities, he starts to talk excessively about the characters in the movies. Games, videos, or pictures. Herbert has started to perseverate over these characters during everyday activities when not engaging in reinforcing activities. This perseveration over the characters has become one of the common themes of Herbert's IRVB. For this study, I used an ABA design to track and graph Herbert's IRVB. During the baseline phase, Herbert's schedule was uninterrupted and proceeded as normal when he engaged in IRVB. Frequency data was collected for all experimental phases. The author refrained from Herbert's vision and listened to Herbert and his therapist while collecting frequency data on how often Herbert engaged in IRVB. The baseline data was recorded on a line graph. The first intervention phase lasted for 10 consecutive sessions after the baseline phase. The second observation phase lasted for 5 sessions to confirm the stability of the treatment. Observations took place at 4:30 p.m. on school days. During the intervention phase, when IRVB occurs inside an existing conversation, the behavior was ignored and the conversation was continued until it was completed. After the previous conversation was completed, Herbert was prompted to ask about the topic of the previous IRVB with an appropriate statement. For example, okay, Herbert, you can ask me about Finding Nemo now. We can talk about this now. When the behavior occurred outside of another conversation, Herbert was verbally prompted to ask questions about what he was thinking. Also, for example, I'm thinking about, can we talk about this movie now? Can we act out this scene? Or do you like? Herbert was reinforced by another person engaging in the topic of conversation that he desired when the time was appropriate. Cumulative results of the design are displayed in Figure 1. The total percentage of IOA collected for the entire study was 96%. Treatment fidelity was collected by 2 supervising BCBAs during 50% of the experimental design. Treatment fidelity was calculated to be 96%. The areas that scored the lowest during the treatment fidelity was during the verbal prompts and appropriate conversation of implementation outside of a previous conversation. Treatment fidelity was never below 90%. Social attention and self-stimulation were confirmed as a function of IRVB and verbal operant training to be an effective replacement behavior in shaping IRVB to an appropriate social interaction. Some of the limitations of the study were not being able to know if the verbal prompts or planned endurance was the most successful. Also, I could only assume that Herbert will be socially reinforced by engaging in an appropriate conversation about the IRVB. Lastly, there were a few people involved for Herbert to have the ability to generalize the skill of engaging in appropriate conversation about reinforcing characters rather than engaging in it independently. Okay? Thanks, guys.